Hey folks, Dr. McCarthy here, author of the McCarthy Method. This is a game-changing book that we've just recently completed, and it's going to give you the keys to the kingdom as far as getting your life back. When the video's done and we're uploaded, I'll put the link down below so you can read some more about what's in the book and how it can help you change your life. Today we're going to talk about the cause of all autoimmune disease. And this is one of the biggest issues that we see with patients here in our office. Autoimmune disease is just exploding here in the United States. Over 100 different named autoimmune diseases. There's probably 60 million Americans who've been diagnosed with an autoimmune disease. Most folks who have been diagnosed with an autoimmune disease have at least 2 or more. Because the issue isn't the disease. It's not like you caught a disease. Everyone that's got an autoimmune issue has a genetic predisposition. And you can see that where there's, grandma, mom, and the daughter all have Hashimoto's, autoimmune thyroid problems. So there's a genetic predisposition, but there's always a trigger that sets off the autoimmune disease. Some folks have the genes for an autoimmune disease but never develop it. Well, why is that? They've never been triggered. So there's multiple things that actually cause autoimmune disease. The problem here in this country is that we treat autoimmune disease with drugs. And that just doesn't make sense. If you developed an autoimmune disease because your body was deficient in a drug, then taking the drug would make sense. But that's not why you develop autoimmune disease. The latest big class of drugs that we see are the biologicals, and we've got great commercials on TV advertising. If you've got such and such, ask your doctor if this is right for you. The issue that we see with that is that, again, it's not fixing the problem. The biologics actually, they work towards tamping down your immune system. And you shouldn't tamp down an immune system. What you should do is get at the underlying cause. What's triggering your immune system? Most of the biologicals, there's like 4 different classes of them. They'll work on decreasing inflammation. They'll decrease B cells, T cells, interleukins, or tumor necrosis factor. And on the surface, that might seem like that's okay, because it might help folks to have decreased symptoms of their autoimmune disease. But it didn't fix the triggers. And there's a couple of common triggers that we see in all autoimmune disease. And the number one thing that we see with folks dealing with autoimmune conditions is food sensitivities. Our foods in this country are so altered and processed and filled with crap that it's no wonder it's destroying our immune systems. Food sensitivities, you've got to get a food sensitivity test done. Everyone is different. You've got to figure out what your food triggers are. Take those out of your life, and that's a huge piece of the puzzle towards getting your life back. Other things that we see are nutrient deficiencies. Some of the most common things that we see are vitamin D deficiency. Yesterday we talked about lab ranges being too broad. If the lab range is 30 to 100 and you're at 31 over here, the doctors will say, oh, you're fine. Vitamin D is fine. In order to have a healthy functioning optimal immune system, you need to be up around 80 to 100. So if your vitamin D is at 31, that's terrible. Vitamin deficiency, nutrient deficiency, these are a big player in triggering and perpetuating autoimmune disease. Heavy metal toxicity, it is a huge problem because we're just, we're breathing in crap all day long in this, industrialized world that we're in now. Between the pesticides that are all over the lawns and all over the food that we're eating, it's just making our body a toxic dump. So, there's two halves to your immune system, Th1 and Th2. There was an interesting discussion we got into earlier today. If you've got an autoimmune disease, is it okay to take echinacea? Well, there's two different halves to your immune system, Th1 and Th2, and it's kind of like a teeter-totter, and it should be in balance. But most folks who are dealing with an autoimmune condition are either Th1 dominant or Th2 dominant. So what we want to do is get your immune system balanced. And to balance your immune system, you have to remove the triggers, and you have to support the balance of the immune system by things like essential fatty acids, vitamin D. Sometimes we use glutathione with folks. And it's okay to use something like echinacea, which is a Th1 stimulant, if we know that you are Th2 dominant. So if you're tipped in Th2 direction and you take something to stimulate Th1, that's okay. If you're Th1 dominant and you take echinacea, you can make yourself worse. So you can't mess around with this stuff. You need to go to someone who knows what they're talking about. And this is something, like I said, that we deal with constantly. So again, the book is the McCarthy Method, and we'll talk more about these issues. I'll put the link down below. Any questions that you have, feel free to ask, or you can always contact our office. Thank you for watching. Share this, like this, help me spread the word. There's not a deficiency of drugs in this country. There's a deficiency of common sense and good food. I hope to help you. Thank you. God bless.